Hi, I am Linda, the creator of information about arthritis. If you are new to this channel, then do not forget to subscribe. Just click the subscribe button below, and then click the notification bell to receive notifications of new videos when they are released. This video is all about osteoporosis, the diagnosis and treatment, and much more. So let's get going. When you develop osteoporosis, the immune system weakens, and the bones become fragile, and have a risk of breaking and fractures. Osteoporosis is an incurable disease that declines over time. It would help if you saw your doctor as soon as possible to stop this deterioration. The condition develops slowly over a few years, and is diagnosed only when you have a fall. The impact will cause a break or fracture. The common injuries are broken wrists, hips, or spine that is called vertebrae. Sometimes when you sneeze or cough, this could cause a fractured rib, or a partial collapse of a bone of the spine. As osteoporosis attacks and destroys your bones, it could mean that you need calcium in your body. In the elderly, you may find that you have a stooping posture or bent forward. It happens when the bones in the spine have broken, which makes it difficult to hold their body weight. Before osteoporosis is developed, you may have a condition called osteopenia. This is where bone density is lower than the average for the age you are. It depends on some factors if you develop osteopenia that leads to osteoporosis. In a healthy body, it is normal to lose bone as you age. When you are young, the bones are strong and thick until in your late 20s. Women can have rapid bone loss after the first few years of menopause, or they have had ovaries or womb removed. Women are also at risk if they do not have periods for more than 6 months, or overexercising, or a lot of dieting. Therefore, osteoporosis is more common in women than men. But men are at risk as the disease is linked with the hormone testosterone, which keeps the bones healthy. Meaning that a low level of testosterone can lead to loss of bone density. A common drug called glucocorticoids is prescribed for arthritis, asthma, eczema, IBD, and many more. But it could cause osteoporosis to worsen. When you stop taking the drug, the osteoporosis will reverse. Researchers found that this drug is the most significant cause of osteoporosis. They also found that it goes on to develop the risk of hip fractures by 60%. The reason for this is that glucocorticoids decrease your bone mineral density. Over time, your bone density will get thinner, leading to fractures and breaks. It also reduces your muscle strength and increases the chance of you falling and breaking a bone. The research also advised you to increase your bone strength by including taking high calcium and vitamin D. But before you take any supplements, you should ask your doctor first. Many hormones in your body affect your bones. If you have a disorder of hormone-producing glands, then you may be at a high risk of developing osteoporosis. This can include a reduction of sex hormones, unhealthy pituitary gland, or an overactive parathyroid gland. When you develop this disease, you should slow down your alcohol consumption, and if you smoke, you should stop as soon as possible. If you are overweight or obese, it would help if you went on a diet, as obesity can be life-threatening. Taking a high dose of steroid tablets for more than 3 months is also a high risk of developing this disease. You are at risk if your parents have this disease, as it could be hereditary. Other risk factors are if you have a low body mass index. If you are on long-term use of medication, such as anti-estrogen tablets, it can affect bone strength or hormone levels. Also, you are at high risk if you have an eating disorder like bulimia. Osteoporosis is also related to diseases such as rheumatoid arthritis, celiac disease, and Crohn's disease. Preventing osteoporosis involves treating the prevention of fracturing, or breaking your bones, also using medicines to strengthen bones. Other preventions that you could do are the following. It would help if you had calcium, as it helps to build your bones and keep them strong. You can take them as a supplement or in foods such as leafy green vegetables, dry fruit, tofu, or dairy products. All of these are rich in calcium. Or oily fish like salmon, sardines, herring, or mackerel. Red meat, liver, or organs. If you drink caffeine, you could make your symptoms worse as caffeine destroys calcium in your body. Therefore, you should stop drinking any related caffeine beverages. Instead, try green tea or decaf. If you smoke, you should quit, as smoking is associated with an increased risk of not only osteoporosis, but many more diseases. Your age, sex, risk of breaking a bone and previous injury history. When you live with pain 24/7, it would be best if you changed your lifestyle, such as exercising can strengthen your bones. You could do some weight-bearing exercises. You could also do some resistance exercises. These are particularly important for improving your bone density and helping the prevention of osteoporosis. Or find an aerobic club for adults aged 19 to 64, as this could help with strengthening your muscles. Or find a gym, which is also good, as you can exercise on the treadmill or the bike. The instructor can help you if you are unsure of how to use the equipment. But if you have been diagnosed with osteoporosis, it is a good idea to talk to your doctor or health specialist before starting a new exercise. All drugs have side effects, and some can be nasty. Obesity is another. You should keep your body weight to your body's IBM range, as obesity can be life-threatening. It's not just adults that can get this disease. Teenagers and children can also develop osteoporosis. So, if your child is obese, you should help them to eat more healthier and exercise more. The diagnosis of osteoporosis is a result of your bone density scan. The treatment is on a number of factors, which includes: when your doctor has diagnosed that you have osteoporosis, they can find out the future risk of breaking a bone. This is usually done online, such as a Q fracture or a bone density scan, as the bone density scan measures the bone strength. Then it is compared to a healthy young adult. The measurement is calculated as a standard deviation and is called a T-score. The treatment of osteoporosis is to prevent fracture, and you need to take your medicine to strengthen the bones. Treating the disease is based on the result of the bone density scan. The decision of what treatment you need is on several factors, including the following: your age and your sex. History of any previous injury. If you need any treatments, your doctor will suggest a safe and effective plan for you. When you are at risk of getting osteoporosis, the steps you should take is to keep your bones strong and healthy by doing the following. Try and do some regular exercises each day to keep the bones strong for as long as possible, including walking or swimming. Have a healthy eating plan that includes calcium and vitamin D. I have got osteoarthritis and researched diets for my pain and inflammation. I have come up with 2 diets: the Mediterranean diet and the DASH diet. You should also make some lifestyle changes, like stopping smoking and slowing down on your alcohol. When you have osteoporosis, you can take steps to reduce the chances of falling. These are taking hazardous items out of the way, such as rugs and carpets, or make sure they are secured down. Put rubber mats by the sink or bath to prevent slipping on the wet floor. Have regular tests for your hearing and sight. Also, if you have a fracture, you can try taking painkillers. But consult with your doctor or physician, as over-the-counter medication can disrupt your prescribed drugs. Hot or cold packs. If you are in pain, you should have a hot pack on the area, or a warm bath or shower. If you are having a flare-up or inflammation, then you should use a cold pack or bag of frozen vegetables. But never use the cold pack or frozen bag straight onto your skin. It is best if you put a towel around it. A daily exercise routine is essential. Adults aged 19 to 64 should do 2 hours of moderate intensity such as aerobic, cycling or walking, each week. Weight-bearing and resistance exercises are important for the improvement of your bone density. Strengthening your muscles is also crucial. They include muscles in your legs, hips, back, abdomen, chest, arms, and shoulders. Healthy eating is important. You should eat a healthy meal of vegetables and fruit, lean meat, etc. Both exercise and eating healthy can prevent many serious conditions, such as arthritis, multiple sclerosis, and many more. If you are worried about anything of your long-term conditions, it is best to consult with your doctor or nurse. Another way to help yourself is to find a help group near you. These groups can help as they are suffering the same as you. Talking to other people may help you to get out and about. You will be able to find a local support group near you on the Royal Osteoporosis Society website. Osteoporosis is a condition that weakens your bones and makes them fragile and breaks easily. The disease often develops in women more than men. Unfortunately, it attacks children. Also, it is incurable. The disease develops slowly over a couple of years and is often diagnosed when you have a fall that causes a bone to break or fracture. The diagnosis of osteoporosis is made with the evaluation of bone density. And the pain can differ from person to person. There are different ways to manage your pain, such as medication like painkillers, heat and cold packs, relaxation techniques, massage or acupuncture, but if you want to do any of these, you should consult a specialist person. Or ask your doctor if they know of a certified person that can do the technique properly. I have tried acupuncture, and it worked for a while, but got too expensive. I am not a medical professional, and the information in this article is for information only. Always consult your doctor if you have any worries. I hope this video has helped you, and don't forget to subscribe to my channel and receive notification when new videos are released. Good luck. Linda.